This is the Emergency Medical Minute, sponsored by Health One.
CSF. Okay, so CSF. So basically, right, we take 4 tubes. We do the spinal tap. We take 4 tubes, and they're numbered 1 through 4, and that's how we collect them. So then we send those down to lab, and they want to do a cell count in both 1 and 4. That's why we do 2, because the first ones frequently have blood in them, and so we want to see if that's clearing. So if the blood persists, like there's just as many red cells as in the 4th one as the first one, then you worry about bleeding. It's actually not a traumatic tap. It's going to be, could be herpetic meningitis or encephalitis or some other cause. So that's the first thing we do is we collect it, send it down, and and tubes 1 and 4 are analyzed for cell count. And 2 and 3 are usually the other studies. So that's going to be protein. And what happens with protein? What do we use protein for? I guess we'll just go over them all at one time. Anybody? Questions? So protein is elevated if you have meningitis. So that's one thing, because you've got a lot of, think of it as bacteria in there, breakdown products, and it releases a lot of protein. So that's one thing we're looking at is if it's got elevated protein, kind of more suggestive of a bacterial infection versus a viral infection. Other conditions are that they analyze the proteins are MS, and so it is useful for other things. But for us, we're primarily looking for bleeding and meningitis, really, right? That's the primary cause. So we want to know if it's elevated in light of elevated infection cells too. And then glucose. If you're kind of thinking about meningitis again, glucose is going to be low. So you think of bacteria in there, and they're utilizing the glucose, so it's going to be low. Think of the bacteria using up the glucose. So one, you've got elevated protein, and then 2, the low glucose. And then we're looking at the cell count. So really above 3 to 5 cells is abnormal for CSF. So if there's 10 cells, that could be early, and it could be, but it's abnormal. We call that meningitis. Now, you can't tell. It's more likely if there's 1,000 cells that it's going to be bacterial meningitis than say what we typically see, which is maybe 50 or 60 cells. That's more likely going to be viral, particularly if it's been going on for a couple of days. But if it just started that day and they come in with a terrible headache and you've got 10 cells, you don't know whether that's going to turn into 1,000 cells or what. It's just kind of suggestive. We use all the things. We use the protein, the glucose, we use the cell count. So anything above 5 cells is abnormal. Again, we definitely see them. Sometimes it comes out as pus, and there's hundreds to thousands of cells. That's usually bacterial. I would say what we mostly see is 50 to 60 cells, and the preferential is lymphocytes, and so that's most likely going to be viral, but a lot of times they get admitted anyway for IV antibiotics until the cultures are negative. So that's another thing we send on the CSF is a culture, and it takes 2 to 3 days to grow out of it. It's sometimes right away, and sometimes. And then there's the type of infection, cell count infection. So I kind of alluded to lymphocytes, which is going to be more like viral, and what would be more like bacterial? Throw that out there. So what other cells are there? There's leukocytes are kind of the white cells, and then there's lymphocytes, monocytes, there's eosinophils, there's neutrophils. Neutrophils are kind of the bacterial ones. Okay, so if there's a predominance of neutrophils with 100 white cells, you're worried that that's going to be bacterial. If it's 98% lymphocytes or atypical lymphocytes or lymphocytes, then you're thinking more viral. But a lot of the times this just doesn't matter. We're going to give antibiotics, admit them, and culture it. The other thing that's important is a gram slug. So you want to take it. They do this on all of our CSF. Is take it, plate it, stain it, and then do they see organisms? They also kind of get the cell count out for that. the cell count is number of lymphocytes per certain diameter, certain size area that they scan. So that's how they come up with that. And then they're going to be looking for bacteria. So that's most of the time that's the last test. And so we're kind of a lot of times you're like, CSF is all back. Let's send them home. And really, I personally wait for the gram stain, because if they call and the patient's gone home and the gram stain, they call and say, well, we think we see bacteria, then you send home this patient, you got to call and bring them back. And that doesn't come up on our Meditech lab screen. You have to look under micro and pull that up, and just something that always delays some kind of CSF. All right, any other questions?
Thank you.
All right.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.